Healthy Living in the Four Corners is brought to you by San Juan Regional Medical Center. One of the most common maladies that men face as they grow older are complications from an enlarged prostate, also known as benign prostatic hyperplasia, or BPH for short. About half of all men over the age of 60 will experience BPH, and by the time they reach the age of 80, more than 90% of men experience the condition. The prostate supports the male sexual reproductive system by producing semen that propels the sperm when a man ejaculates. In a post-pubescent male, the prostate is about the size of a walnut, but around the age of 40, the prostate experiences a second growth spurt and it can grow to the size of an apricot or a lemon. That's when problems start to occur.
First are the obstructive symptoms, of course. So you get some weakening of the urine flow, frequency, or really an intermittency of flow also, where you kind of start and stop, difficulty starting the flow, feeling like you're not emptying all that well. As time goes on, the bladder, which is just kind of the pump to get that urine out, can get irritated. So then you start getting into the irritative symptoms like frequent urgent urination where you got to go right away. Getting up multiple times at night to go urinate. And for most men, it's some combination of those obstructive and irritative symptoms that are causing the problems.
An enlarged prostate can interfere with the flow of semen and ejaculation, or worse yet, it can damage the bladder, weakening it so much that you could wind up using a catheter the rest of your life. That's why it's important to seek treatment.
It's terrifying. A lot of men are terrified to come in and deal with these issues. And there's really two reasons to come in and be checked out if you're experiencing any of those symptoms. Number one, it's quality of life, of course. You're getting up frequently at night, you're worried about being close to a restroom, so quality of life's important, but the bladder doesn't necessarily squeeze forever. If it gets more and more obstructive, we have plenty of patients who wait decades into these symptoms and are catheter dependent for the rest of their life because the bladder just stops working. That is not all that uncommon around here. So it's quality of life, but also it's medically important to get these things straightened out and checked out and followed.
Treatments for an enlarged prostate range from drug therapies to removal. One surgical option, called the transurethral resection of the prostate, or TRUP, reduces the size of the prostate by cutting away portions of the interior to provide an opening for the urethra. But now, the doctors at San Juan Urology in Farmington can offer a simpler, less invasive outpatient surgery called the UroLift.
We're able to go in and essentially deploy sutures that squeeze that tissue open. It anchors on the outside of the prostate and the inside of the prostate, and those permanent sutures tighten and open up the prostate channel. So it's one more option to treat such a common disease. This is a much less invasive option to get off of medications or to get rid of medications that are causing problems without any cutting or burning. It's a basically 8 to 10 minute procedure. It can be done under sedation or even with just local anesthetic in the bladder.
Drugs and surgeries that remove part or all of the prostate can affect a man's sexual functions, but the UroLift reduces the risks of side effects.
There's not so much erectile dysfunction, but some of the sexual side effects would include ejaculatory dysfunction that you can get with the medications. Also with the TURP, that's almost a guaranteed problem. With the UroLift, it's not. Almost 0% of patients have to deal with those side effects.
If you'd like to know more about the symptoms and treatments available for enlarged prostate, visit sanjuanregional.com/urology.